The one day that I decided to count how many orgasms I had, I counted 180 in 2 hours.
What? Oh my goodness. Extra appendages, Harley Quinn in real life, and a strange condition that affects approximately 1 in 20 million births worldwide. Get ready to have your mind expanded because today we are breaking down some of the most interesting and rarest body conditions out there. All right, let's dive right in.
A six-fingered family has been embraced in Brazil as a lucky omen for the country's football team.
Oh, super cool.
Since the last World Cup, we've wanted Brazil to win its 6th championship, so we can show with our 6 fingers the number of times Brazil has won.
Multiple fingers, that's something called polydactyly, and it's actually a congenital anomaly, and it can range from being a very small little nubbin to like a normal finger.
14 of 24 members of the Silver family were born with polydactyly, a genetic condition in which a person has more than 5 digits on their hands or feet.
So this individual has central polydactyly. So there's also pre-axial and post-axial. So central meaning central, so there's actually a functional normal finger.
It's cool. I'm proud of having 6 fingers. It's easier to grab things and do other stuff. I've never played the piano, but I want to learn, and it might be easier playing with 6 fingers.
Super cool. This family, it gives you a good example of syndromic form versus isolated. With this, it's functional, it's not in the way, versus other individuals may seek to have surgeries for this or when to have surgeries. 2 different reasons why you do surgery, right? Cosmetic versus is it actually in the way and is it inhibiting what you need to do on a daily basis.
Cara was diagnosed with persistent genital arousal disorder and can suffer from feeling aroused for up to 6 hours a day.
6 hours of the day this individual is having orgasms, and it's not something that is pleasurable. It's impeding this individual's life. It is a condition and disorder that is very distressing, affects multiple facets of this individual's life.
The one day that I decided to count how many orgasms I had, I counted 180 in 2 hours.
What? Oh my goodness. This disorder, it's not really well known. Is it relating to anatomical abnormalities, hormonal impulses? And so then you have gynecologists looking to make sure that the anatomy is appropriate. You're talking to neurologists to see if there is nerve pathways that are going on.
Cara has sought the advice of numerous doctors and specialists, but sadly so far has found no treatment for her symptoms.
What can you do? How can you treat this? There's not a lot of good options out there. What doctors will try are antidepressant medications, selective serotonin reuptake inhibitors trying to decrease the arousal state. Then there's other components where you're giving a nerve pill such as gabapentin to try to decrease the nerve impulse and nerve firing to the area. Kind of multifactorial of trying to get individuals through this disorder.
Thomas and Vincent's headgear might look like it's out of a science fiction movie, but it's been developed by a team of doctors to shield them from certain death. The twins were diagnosed with xeroderma pigmentosum, known as XP.
Your body is so sensitive to the ultraviolet rays of the sun. Individuals with this are so sensitive to it that they have a massive increased risk of damage to their skin, which then also leads to skin cancers.
Both parents were carriers of a gene mutation, and this was passed on to the boys. It's so rare that it's only seen in 1 in every million births.
So their parents had a gene mutation, yes. It has to do with a repair pathway of your skin and basically has to do with the repair of the damaged cells and DNA relating to the UV rays.
C'est une maladie qui est fatale, oui, dans le sens où pour les personnes qui ne se protègent pas sur toutes les fenêtres de la maison, de l'appartement, on a mis donc ce filtre qu'on a scotché autour de chaque carreau fenêtre, et comme ça on est protégé.
Wow, so like these guys have to totally have like their environment protect them. Coverings over the windows, specific filters to help filter out the UV rays.
Hunan Province, southern China, home to 37-year-old Huang Shungkai. Huang is suffering from the world's biggest ever facial tumor and has the worst recorded case of neurofibromatosis.
Neurofibromatosis is a genetic abnormality where you have these growths typically underneath the skin. Different types of neurofibromatosis, NF1, NF2.
The rare genetic condition causes excessive cell growth and tumors that have melted his face.
We say tumors, but they are benign tumors, non-cancerous tumors, but they just continue to grow.
When he was 4 years old, his mother noticed small tumors appearing behind Huang's ears.
He's actually doing a really good job of like maintaining hygiene and cleaning these areas because of the folds. You can have different microorganisms grow in these areas, typically like fungus. So it's really good to keep it dry and clean.
By age 31, Huang's facial tumor weighed 25 kilograms.
Different therapies and options that we have for these people kind of limited, unfortunately. As I said, it's a genetic anomaly versus elephantitis, which is actually caused by a parasite. They have similar appearances, but there are different pathways and different mechanisms why individuals have these growths.
Rare aging disorder called progeria.
Well, her food's ready.
So progeria, also known as Hutchinson-Gilford progeria syndrome, this is where short stature, small, age quickly, and then typically do not have a very long life, and we'll talk about that shortly.
Give me the backpack.
We don't talk about life expectancy or any possibility of this could happen or that could happen to her. I mean, we just live day by day.
I mean, anything can happen to anyone, right?
Exactly, yeah.
Super rare, 1 in 20 million births. It is a mutation in the LMNA gene, and it has to do with encoding for proteins in the cell nucleus and the integrity of it. You'll have skin changes, which is due to like aging and wrinkling of the skin, and unfortunately, this process is fatal. Most of the time it's a cardiovascular issue where there's plaques that develop as we age and then can cause blockages and heart attacks.
She has like 14 million people on her Facebook and all her subscribers on YouTube.
It's cute. Having a very rare disorder is really tough for individuals because the fact that there's not a lot of people that have it, there's not a lot of financial backing behind it, so that's really hard to get a lot of research done.
Comfy, cozy, snuggly? Yeah. You want to put your sweater on?
It is a condition that affects his skin, and it makes it very, very thick and scaly.
Ichthyosis is a severe and rare genetic disorder having to do with the lipid layer within the skin that's not there. It's characterized by almost like really thick diamond kind of shaped scales.
The amount of skin that comes off is absolutely crazy.
So one of the therapies is to exfoliate and to get off the skin because it's hyperkeratinized, so it's really growing a lot and it becomes super thick and you need to get it off there.
He can't sweat, so he can overheat very easily. He can go into heat stroke very easily. He can have seizures.
So when the infants are born, typically they are born prematurely and they're like caked in the skin, which covers most of their entire body, and it is quite painful. So life expectancy is a large range, and so it does have a poor prognosis, and sometimes individuals pass away in the first week, but with better therapies and awareness, we're getting up to a big range, anywhere between 10 months to 25 years. Wow, so very interesting disorders. Hopefully you guys learned something, and if you did and you want to see more, please let me know. And as always, do me a favor, check out this playlist right here, binge watch everything, and also subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.